Democratic presidential candidates Senator Kamala Harris, Elizabeth Warren, and Kirsten Gillibrand have all signed on to Senator Bernie Sanders' Medicare for All bill, legislation that would ultimately get rid of private health insurance companies in the U.S. in favor of a government-run universal health care system. Harris talked about this in her town hall earlier this week. So for people out there who like their insurance, they don't get to keep it?
Well, listen, the idea is that everyone gets access to medical care. And you don't have to go through the process of going through an insurance company, having them give you approval, going through the paperwork. Let's eliminate all of that. Let's move on.
Since that town hall Monday night, Harris's office has said that she is also open to health care reform proposals that have a role for private insurance companies as well. But as CNN's Dr. Sanjay Gupta reports for us now, support for Medicare for All has become something of a litmus test for the 2020 Democratic candidates.
It's become the go-to healthcare idea for potential 2020 Democratic candidates.
I actually feel very strongly about this, is that we need to have Medicare for all.
It could be Medicare for all.
That's what Medicare for all is all about.
But what exactly is Medicare for all about? Depends who you ask. Medicare, which has been around since 1965, is the government-run health insurance program that primarily provides Americans, 65 and older, with basic health care coverage, covering hospital stays and doctor's visits.
So put simply, this program would then expand Medicare to everyone?
It would provide essentially free care to patients when they go see a physician or go to the hospital.
Kenneth Thorpe is not a politician. He's a professor of health policy and management at Emory University.
Free sounds wonderful. Who doesn't want to have free care? But the reality is, in order to finance this, people are going to have to pay more in taxes, in payroll taxes, in corporate income taxes, in order to fund this free care.
Health care in America must be a right, not a privilege.
Bernie Sanders introduced the Medicare for All bill in 2017 that has now been co-sponsored by fellow and current Democratic hopefuls like Kamala Harris, Elizabeth Warren, and Cory Booker. In his bill, health care is described as being totally free, covered by taxpayers, with no out-of-pocket costs at the time of service, even for vision and dental, just co-pays for some prescription brand name drugs. All of that while providing access to everyone and dramatically reducing costs. But it is worth taking a closer look at the numbers. In the United States in 2017, we spent $3.5 trillion on health care, nearly double of what other high-income countries pay per capita. Blame administrative costs, prescription drugs, lots of tests and procedures, and not enough preventative medicine. Change that, and Sanders believes we could cut health care spending from $3.5 trillion to $1.4 trillion a year.
Those numbers dramatically underestimate the increased spending associated with providing everybody free care.
Both the conservative-leaning Mercatus Institute and the left-leaning Urban Institute have analyzed Sanders' recent proposals and estimated that a Medicare for All plan would cost $32 trillion in new federal spending and taxes over the next decade, while saving only $22 trillion from the private sector, meaning Sanders' plan still needs to come up with funding for another $1 trillion a year, and that even though many will pay less in premiums, many will also still pay more overall in taxes.
In essence, you'd have to raise an enormous amount of money to finance this.
A lot of numbers there, Jake, and the bills and the proposals are likely to change, as you found out during that town hall. What I will say is that across the board, just as of this month, there is broad support for a Medicare for All program. About 56% of the population surveyed saying that they support something like this versus, as you see there, 42% against. Jake?
And we should point out, I asked Bernie Sanders about this, Sanjay, and his argument is people will be more willing to pay more in taxes when they realize that they're not going to have to pay insurance premiums.
Right. But the question again is, do they offset each other? And what you find from the analysis is that $32 trillion increased in federal spending, $22 trillion decreased in private costs. There's a $10 trillion shortfall there. So you may pay less in premiums or no premiums, but you'll more than pay for it in taxes, at least according to that analysis.
Right. And it depends on the legislation, of course. Dr.
That's right.
Sanjay Gupta, thank you so much. Appreciate it. And let's talk about this. We should point out that Senator Harris just tweeted a few minutes ago, access to health care shouldn't be a privilege. It should be a right. When my mother passed away, she had the benefit of having Medicare, but not everybody does. Too many people are dying because they can't afford medical care. That's inhumane, and why I support Medicare for all. She does seem to be perhaps a little bit in the clarifying mode after saying that she supported getting rid of insurance companies. Now she's saying she is willing to look at other plans too that maybe preserve a role for insurance companies.
Well, the mistake she made in the answer she gave you in the town hall was not expanding on the options she's long supported. I mean, she has been an advocate for Medicare for all for over a year, but she's also been supportive of a number of other proposals, as a number of other senators have been. I mean, Medicaid buy-in, there are a lot of different options. Democrats would definitely help themselves if they rebranded this and gave themselves a little bit more room, because Democrats have a better argument to make on what they're going to do on health care. But Medicare for all, when people get into the details, that may not be their first preference. They may like Medicaid buy-in better. They may like single payer better. And that's something I think that all the Democrats in the primary could help themselves in the general election.
So here's what they could do to help themselves in the general election. Explain where they're going to get $1 trillion a year. $1 trillion. I don't even know how many zeros it is. It's a big number. Okay? Just explain that to the American people. We're going to raise your taxes by $1 trillion a year.
If Donald Trump is held to that standard, he can explain how he's going to pay for the high-income tax cut. I mean, that's not the standard.
It is going to be the standard, Jen. It's going to be the standard that people are going to ask in an election. They're going to say, we're going to give you all this free stuff, but we're not going to make you pay for it.
Jamal?
You can't promise that.
Yeah, so first of all, Senator Harris, welcome to the NFL. I think when you're running for president, you learn that the things you say carry weight, and you've got to be a little bit more precise with your language. I think she learned that this week. Jen is right here. We've got to find a way for Democrats to have a broader conversation about health care for all, because health care for all is actually something every Democrat can buy into. Medicare for all is something that seems to divide Democrats. However, for people on the left of the party, the people who are powering a lot of the dynamic of the debate, Medicare for all is almost becoming a litmus test.
Yeah, progressives want that.
But you have to be for that particular policy. That is the thing that I think Democrats have to be careful about, because there are all these questions that come up. And there may be some ways to get to health care for all that aren't as onerous.
And Howard Schultz isn't going away, people.
Yeah, I just got to say, I think she knew exactly what she was doing in that town hall. She knows what Medicare for all means, and she knows it means the elimination of private insurance. That's why I was
Bernie
shocked
Sanders' bill does, yeah.
to see how casual she was when she goes, yeah, let's eliminate that. So she may want to give herself wiggle room now. Yeah, she's sponsored. Let me finish. Okay. She's sponsored a number of bills because she wants to do the most viable option. And right now she's chasing that Bernie Sanders vote. She wants to convince progressives she is the candidate they should unite behind, but she did also realize how this is playing with everyone else that has employer-sponsored insurance. It's half of the market.
Yeah, and I want you to take a look, because Medicare for all is actually, on its own, a popular concept, not just with Democrats, but with the American people. The Kaiser Family Foundation poll released this week finds 56% of the American people support the plan, as opposed to 42% opposing it. But when Americans are asked about a version of Medicare for all where there is no private insurance, support for that drops to 37%, opposition to 58%.
And that poll, when asked if you have to pay more, what would you prefer, right? The number drops precipitously.
And the question is, who has to pay more?
This was exactly my point, but I think my point is that there is broad agreement among not just Democrats, but independents and many Republicans that more needs to be done on health care. That's the number one issue in every poll, still continues to be. Democrats have a better argument on it. It will be some version of expanding Medicaid, Medicare coverage. What that looks like, we should leave ourselves some room to determine.
Now, we should note Howard Schultz, the potential independent candidate, called the concept of Medicare for all un-American. He walked that back. Kamala Harris, not the only one doing walkbacks today. He walked that back
is hard.
in an interview with Poppy Harlow earlier today. Take a listen.
Why do you think Medicare for all, in your words, is not American?
It's not that it's not American, it's unaffordable.
All right, well, that's a walk back.
Well, because he knows what $1 trillion is, right? That's as much he made at Starbucks. So he knows what
Republicans really don't have a lot of leg to stand on and talk about spending money. We went to war without
nobody
paying
does
for
in Washington.
Jamal,
we cut taxes without paying for it. And in fact, in the George W. Bush administration, we went to war and cut taxes.
But Jamal, when you're
one.
going to go to people and say, you're going to have this debate, that's going to be the question. How do you pay for it?
I would just say the
Democrats it's going to be not one-sided.
Should worry more about their candidates ripping away health care from 50% of the market than anything Howard Schultz has to say.
You mean the insurance, taking away the insurance?
Oh, sure, but if you don't have insurance, how do you get... If you get your insurance through your workplace and all of a sudden that's gone and you're shoved into some other system, that's not if you like your plan, you can keep it. It's gone. It's over. You're getting shoved into the Medicaid, Medicare system.
Right, but yes, I'm just saying it's not like you don't have coverage. It's just that it might be coverage you don't like.
Do you think a lot of doctors are going to accept that brand new pool of people from the government that underpays them?
And then you'll be like Canada and lots of other places where you can go buy additional insurance to see doctors
be
more
the
quickly.
deciding factor in 2020, and Democrat will be in the White House?
Yeah, it worked out pretty well in 2018.
You know what? I like the fact that we're talking about 2020. We're talking about issues. It's not true. It feels different than 2016.
And here's what else we're talking about, Jake, really quickly. We're talking about covering people for all health care. We're talking about how do we tax the wealthy. But we're talking about tax cuts and taking things away from people.